I'm Dr. Julio Gutierrez, and today I want to talk to you about the liver transplant listing process. I think some of you may have heard about liver transplant and aren't quite sure what the process to get on the list is, and that's what I want to talk to you about today. I think everybody has an idea about the liver being very important to good health. And we can see what are the side effects of poor liver function when patients have advanced cirrhosis. Liver is very important for removing toxins, bacteria, unusual medications. It helps the body make proteins, produces biles, and helps absorb vitamins like A, D, E, and K. The liver is actually a storage vessel for many vitamins, minerals, and sugars. And it also produces nutrients that help food to produce energy. How does the liver get sick? Well, here's a lot of different examples of causes of liver disease. I think the ones that are a little bit more unusual here are hemochromatosis, Wilson's disease, alpha-1 antitrypsin, Budd-Chiari, primary biliary cholangitis, and primary sclerosing cholangitis. Maybe more common in the United States, there is viral hepatitis like from Hep B and C, fatty liver, and alcohol liver damage. And as I mentioned, these are more common, especially the fatty liver and alcohol, and they have overtaken hepatitis C as the leading cause of liver transplant. And that's because we've discovered how to cure Hep C. And many people, even when they have very advanced liver disease, if they get their hepatitis C cured, because Hep C is curable, they can recover liver function and not need liver transplants. What are the complications of severe liver disease? Well, some of you may have already experienced it. Turning yellow and having your eyes change color from bilirubin being elevated is common. Many patients will bleed from veins in their esophagus called varices. You may get confused. That's called hepatic encephalopathy. The hallmark of this is putting your hands out. We see a little bead come out. Many of our patients also suffer from ascites and fluid retention. Finally, liver cancer. These are all common reasons why liver transplant becomes more important for our patients. So the big question you may have now is, am I on the liver transplant list? Well, if you are, you will have received a letter from the transplant center you're visiting indicating that you have or have not been listed for a liver transplant. Just by meeting or having a liver doctor, you're not on the list. And there's a process that goes into getting on the list. And this can help you get what you're after, which is a liver transplant. So when should patients be referred to a liver transplant program? In my opinion, when a patient receives the diagnosis of cirrhosis, it's a good time to consider visiting a liver transplant program to understand where you are on the spectrum of need for a liver transplant. We should definitely be considering liver transplant when one of the major decompensation events related to liver disease occur. And that includes ascites, variceal hemorrhage, hepatic encephalopathy, a diagnosis of hepatocellular carcinoma or HCC. And what I think most patients notice first is turning yellow. Any of those things happen, you should definitely have seen a liver transplant doctor. Other important times to consider liver transplant is when a patient's in acute liver failure. And one of the most common reasons for this is Tylenol overdose, or when your MELD score goes over 12. What's the MELD score? Well, I'm going to talk to you about it a little bit, but this is how we allocate organs and also rank how sick our patients are. So here's what the MELD calculator looks like on the left. And you can see it requires the creatinine, the total bilirubin, the INR, and the sodium level. And you could get those labs from your routine lab reports that your doc's running and use that to do an online calculator. For liver transplant, we're using the MELD sodium now, so that's called MELD NA. And the average in our region right now is around 35. That's about when a patient will get a liver transplant, when their MELD score gets to 35. 6 or 7 is about as low as it can go. 40 is technically the top MELD score you could have. And again, in our region, we see people getting them around 35. And that changes depending on what state you're in significantly. So many people will die of liver disease and never get listed for transplant even. We had 19,000 people on the liver transplant list last year, and around 6,000 of those patients will get a liver transplant. And currently in the United States, there's 137 liver transplant programs in 37 states. So many states don't even have access to liver transplant. One common reason for needing a liver transplant is having liver cancer. And we see liver cancer usually develop in our patients who have cirrhosis, and liver transplant is the cure for liver cancer. And in fact, if you have liver cancer, instead of getting routine points for how sick you are based on your blood tests that I showed you, patients with liver cancer get exception points for hepatocellular carcinoma. Most people who need a liver transplant in the United States right now are around 60 years old. Many will have a history of obesity and or diabetes. Because of those, they're going to be at high risk for coronary artery disease and chronic kidney disease. Many will have a history of fatty liver and alcohol abuse. And a common thing we see in our patients is that they're decompensated. They have ascites, they have varices, they have hepatic encephalopathy, and they'll be at risk for cancers. You can see here is mortality related to end-stage liver disease. This is how frequently people are dying, and it's getting worse. It got worse from the 90s to more recently. And you can see where it's red, those are where it's very active. We have a lot of liver disease all over the country, but especially in our region, California and the West. Liver cancer epidemiology is very similar to that last graph I just showed you. And you can see it's increased significantly recently, comparing 2001 on the left to 2017. And you can see some real hot spots for liver cancer. That's California and Texas are sort of leading the way with the highest rates of liver cancer. In our region, we see not only regional variation, but also ethnic variation, with Hispanic males especially having the highest risk for liver cancer in our state, right here in San Diego. And you can see more dramatic differences in just our local regional incidence of liver cancer, with the highest rates of liver cancer being in South San Diego. The reason for this is sort of incompletely understood right now, but it may have something to do with the environment and also the population of these areas. What about alcohol? Can you get a liver transplant if you have drank alcohol in the past? Well, we used to have the famous 6-month rule. The 6-month rule indicates that if a patient has consumed alcohol within 6 months, then they would not be a candidate for a liver transplant until they achieve 6 months of sobriety. But now we've reconsidered the benefits of liver transplant in this population and how to examine to see if somebody's a good transplant candidate. And what we see is good transplant candidates don't have polysubstance abuse. They have good psychosocial status. They tend to be younger, and they have a lot of caregivers. So now, instead of considering only patients who've been sober for 6 months, we consider patients who did not know they had alcoholic liver disease and good psychosocial features as a possible immediate candidate for liver transplant. And that's through our alcoholic hepatitis protocol. So who schedules the evaluation? Well, we have a wonderful team of coordinators in our office, including Veronica, Andrew, and Penny, who may be helping to schedule your evaluation. Our team will help get these things done as quickly as they can and potentially even at the same time. Let us know what you need to get your schedule done. But it's very important to get this done as quickly as possible, because the longer it takes to list you, the more risk you have when you're not listed. Here are the tests that we need to perform a liver transplant evaluation. And you can see that many of the tests there shown on the left are about your heart. And that's because the heart does a lot of work during a liver transplant. This is one of the most intense surgeries a person could undergo, and the cardiac function has to be excellent. Most patients will get a heart EKG and an echo with special bubbles. Some will also need some kind of stress test or special imaging of the heart. In addition, we may want to do a chest CT, but sometimes a chest X-ray is just enough. Arterial blood gas and pulmonary function tests are very important for us to understand your pulmonary function. And we have to get a special picture of your liver called multiphasic imaging, which is usually done with an MRI or CT. And there's a lot of blood tests. If you haven't been keeping up with your healthcare maintenance, then you'll have to do those. That may include for you a colonoscopy, upper endoscopy, mammogram, pap smear, and DEXA to see how healthy your bones are, and a dental exam. The key people you have to meet are shown here. Really, some of the most important people are our transplant care coordinators and our transplant social workers. But you also have a chance to meet with the nutritionist, the surgeon, a pathologist. You'll have to find your own dentist and get your teeth cleaned and cleared for transplant. And in some cases, we have to do cardiology consults, pulmonary consults, diabetes educator, infectious disease, or even see a nephrologist. So what do you have to do to get on the list? Well, first, as I said, you have to do the medical testing. And really, the purpose of the medical testing is to understand whether liver transplant is medically safe for you. Can you handle it? Then the surgeons are looking at you. They want to know, is your abdomen operatable on? Is all your vessels well connected? So they're going to have questions about that. We have our psychosocial evaluation, which includes our social workers, or caregivers, and understanding whether you're going to have enough support for liver transplant. And finally, you'll need financial clearance from your insurance company. And also, we'll have to review your insurance to make sure you can get the liver transplant medications after transplant. So how will a liver come to you? Well, there's several pieces here. First, you have to have the right blood group. So if you are blood group O, you will be a candidate to get organs from somebody who has blood group O, which is shown there on the left. That's the toughest one, since there's so many more people with blood group O, and blood group O can also donate to A, to B, and to AB. And so you can see blood group's important. And then once we get past the blood group, then we would go to the MELD calculator. Is your score high enough to qualify for this transplant? And then the third step is that the organ's got to be just right for you. We can't take Shaquille O'Neal or liver and put it in a tiny person. It just wouldn't fit. And we can't take a tiny person's liver and put it in front of Shaquille. He would get something called small for size syndrome and not do well. So the liver's got to be just right for your body size. So again, you can calculate this MELD score yourself, find this MELD calc, and it'll tell you your MELD sodium level. If you have liver cancer, you'll get special exception points. And at the time of transplant, you're most likely to have what we call the mean MELD at transplant -3. And right now that would be a 32 in our region. So once we have all your information together, all the key consultants and team members will be at our transplant committee, where we decide whether a liver transplant is right for you. Usually, the process is a smooth one, and we're able to get a consensus plan for our patients. Here's an example of some different procedure techniques for the liver transplant. You'll get an opportunity to talk to your liver transplant surgeon about this more, to ask him questions about the liver transplant procedure. Here's the gift of life, beautiful liver that's gone into one of our patients. So you can see the goals of liver transplants are to give people on liver failure a chance to recover good health. Most of our patients will live at least 5 years, and many will live many, many more years. I have some survivors who are long-term heroes of transplants who are alive for 30 and 40 years after the transplant. So it's very exciting, especially to see patients recover quality of life and good functional status. Many patients who get a liver transplant can't go back to work, but for those who do, I get really excited to see them have good quality of life and good functional status after transplant. Again, most patients do very well after liver transplant, with at least 75% of patients surviving at least 5 years. So, the most important part of the liver transplant process is the patient and the grafted organ. And we're going to be circling you with our multidisciplinary team to help you achieve good care of your organ and your health. And that's really exciting for us. Thank you guys so much for listening to this talk. I hope this is going to benefit you to learn more about liver transplant. Here's some of my clinics. I'm at Scripps Green, Torrey Pines. I also have an MD Anderson clinic in Hillcrest. And finally, I go also to another beautiful clinic in Eastlake, California. So please visit me at any one of these spots if we haven't met. Thank you for listening to this talk about the liver transplant list.